If you've been given a job of managing and you have to lead people and there are other people that depend upon you and their joy in work is dependent upon what happens day to day, then it's incumbent upon you as the manager to learn how to lead better. And we think this is not the end all, this is not the only paper that anybody will ever read, but this will help you think about what, as a leader, as a young leader or a new leader, what I could do, what I might do differently that could make our unit more effective, make the teamwork more effective, that leads to a goal of improvement. So not just how do we make it more effective and more fun to be around here, but leadership is about achieving specific aims. So as a manager and a leader, you've got some aims. You got to think about reading this paper as a way of helping you think about how to do that more effectively, efficiently, and achieve those aims. Well, the impetus was, again, to help and answer questions that leaders at all levels of organizations have about, as a leader, what do they need to do to drive improvement and innovation. So it's not a paper on leadership in general. It's really focused on what do leaders in healthcare delivery organizations, how can they be more effective and accelerate the rate of improvement in their organizations. The first is how leaders think. So what leaders think and how they think is very important. Turns out that mental models and how you see the problem tends to define what you think that the answer set might be for that particular problem. So as an example, if you think that the issue is around patient satisfaction, and you want to improve patient satisfaction, you might deploy a whole series of things and look for solutions around customer service, facilities, things we've traditionally done. But if you shift that mental model and you say it's not about patient satisfaction, it's about engaging patients in their care, well, then that opens up a whole different universe. The second area of the paper is perhaps the most important and certainly gotten the most uptake and press, and people have responded to us. And that is, we interviewed a lot of leaders, we thought about it, we used our own experiences, we had an IHI innovation effort, and we looked at what we call high impact leadership behaviors, and identified 5 behaviors that seem to cut across organizations and help to build will, help to deliver results. And then the last part of the white paper really is about what we call the IHI High Impact Leadership Framework. And this really builds on what we've done at IHI over the years. So it builds on the idea of will, ideas, and execution, which Tom Nolan brought to IHI years ago, and it's been sort of a mantra. It builds on the 7 leadership leverage points. And it's really a tactical framework for where leaders need to focus their efforts to drive improvement and innovation. I've been surprised by how much resonance there is with people around the leadership behaviors and the amount of leverage that those leadership behaviors tend to have in an organization when they're consistently practiced. And what you find is that some of the behaviors, leaders come from all different backgrounds, different styles, different approaches, and those behaviors are not style dependent. Whatever you bring to the table as an individual leader about your belief systems, these behaviors we've identified seem to be really helpful and consistent with a lot of different sort of leadership books that are out there, so that you can practice those behaviors. It doesn't matter what your personal style is.